change things around a little bit, I think, from what we've been talking about, but I hope that you will find this useful and applicable in understanding conscience. So I am a physician, internal medicine, I do practice, and I love my practice. I sometimes call myself an undercover physician for obvious purposes. I am a Dominican sister, by the way, in Nashville, Tennessee. So I have no disclosures to make at all. Nobody pays me to do anything, basically. Except my travel expenses to come here have been paid by your organization, so I'm grateful for that. I didn't list the objectives in the handout that you have, so I will just tell you that there are 3 of them. We'll be explaining what conscience is and what it is not. We will be applying the issue of conscience to the practice of medicine. And I will be differentiating technicians from physicians, which is the core of my presentation. So I'm actually going to start with a story of a man by the name of Franz. Could I see our show of hands of how many people have ever heard of Franz? Great. Okay, good. Nobody. This is good. All right, so Franz was actually an Austrian. He was a Catholic, lived in the 20th century. He was actually a very ordinary man, had no degrees, was a farmer, lived in a small rural village in Austria, and he realized what was going on in Europe. He actually, even though being fairly uneducated, he apparently was somewhat well-read, and he knew the problems with Nazism. He understood that the Catholic Church had already, there in fact was a teaching from the Pope on the evil of National Socialism, and he also knew that the Pope and the Church had never revoked that. And he actually spoke out within his own village against National Socialism, against Nazism. He was really the only person in his village to do so. He was a married man with 2 young children, and when the Anschluss happened and Austria was annexed into Germany, he saw that as possibly the saddest day ever for Christianity in Austria. He knew that at some point he was likely to actually be called up to serve in the army of the Third Reich, and he had consulted with many people. He felt that that National Socialism was so evil that there was no way that he could cooperate with that, and that he would have to refuse being drafted into the army. Many people tried to talk him out of that, including a number of pastors and possibly even one bishop. And they said, you know, you're married, you've got young kids, there's got to be something you can do to just cooperate a little bit. You know, just take a desk job or something. And he held to the position that even holding a desk job for the army of the Third Reich would mean that he was making it easier for them to do all the evil that they were doing. And he felt he absolutely couldn't do it. So basically there was nobody who supported him, except he felt that in conscience he could not cooperate. So he was called up to serve in the army. He went to the place of the appointed time and he said, I will not serve. He was arrested and he was executed for sedition on August 9th, 1943. Now, some people would think that that was idiotic, and some people would consider him a hero. And really, I think many of us would ask, well, what difference would it make? You know, what difference would it have made if he had cooperated just a little bit? I mean, in the big scheme of things, was there any real difference that he was going to make? Yet he is celebrated by many as a martyr of conscience. So what is conscience? Conscience can be defined as a judgment of reason whereby a human person recognizes the moral quality of a concrete act that he is going to perform or he's in the process of performing or he has already performed. Now, conscience, so it's a judgment of reason, right? It's not with feeling. And I think this is one of the biggest misunderstandings today of this concept of conscience. Right? The word itself, conscience, means with knowledge. It's not with feeling. It's not even what my church tells me that I'm supposed to do or not supposed to do. And I do realize there's an important reason why conscience is tied into religious freedom. But conscience is not, at its heart, simply a religious faith. It's not a strongly held belief. It's how you come to a judgment based on reason. That is, that you take the reason that the things that you know, you take this knowledge about general things, and you apply it to the particular. And it assumes that this knowledge that you have is actually truthful. Now, to understand that, we have to understand what truth is. A lot of misunderstanding about that these days, too. Truth, by definition, is the conformation of the mind, of your intellect, to reality. The conformation of your mind to reality. You know, today we have the expression of wrapping your mind around something. That's exactly what this is. Wrapping your mind around something, that's confirmation. So it's confirmation of your mind to reality. It presupposes that you are not the author of reality, that reality exists outside of you, and you had nothing to do with creating that reality. But it also presupposes that you can understand that reality. Now, as a room full of scientists, I hope you know that this is what science is based on. Scientists assume that there is a reality outside of us. It also assumes that we can understand that reality, that we can wrap our mind around it, and that we know it truly, and that we can communicate it to others. If we don't accept that, we can't be scientists. We're just imagining things. So science assumes there's a reality out there, and it assumes that we can know it. Now, I put up here a number of statements that we hear these days about truth. And I'll talk maybe just about one of them, but you've heard these things. There is no truth. We can't really know truth. Truth is relative. There are no absolutes. You can't be sure if you know the truth. I'm sure you've heard all these things. If we just take one of them, there is no truth. We can demonstrate with that one what we can demonstrate with all of these, and that is they are all self-contradictory. If there is no truth, then that statement can't be true. And if that statement isn't true, well, then there's truth. Okay? We actually live our lives every single day believing in truth. All of us, whether we're atheists or whether we're believers. And we have to stop pretending like we don't. Ultimately, we know that truth leads to freedom because it allows you to make decisions that are in fact real. Without truth, we live in a world of delusion. You know, even psychiatrists believe in truth because they think there is something called delusional behavior. Right? When somebody's acting delusionally, it presupposes that there is something true that that person is not in touch with. And so with truth, we can live in freedom. And I would say that Franz was in fact the most free person in his situation in his day. All right, so conscience is a judgment of reason. It takes some general truths that we know and it applies it to a particular case. All right, so there's a subjective decision to act in a particular way, but that subjective decision is based upon objective truth. We believe that we have taken truth in and we are therefore acting in accord with that. So it's subjective only in the sense that I am the person making the decision to act in a particular way. It's not subjective in that I'm defining truth. Conscience doesn't define what truth is. Conscience is a way that I can make a reasoned choice to do something or not to do something based upon a truth that exists outside of me. Now, if you think about this, taking general truths and applying it to particular cases, this is what we do in medicine every single day, with every single patient we encounter. Okay, so this is not something just about abortion or contraception or euthanasia. This is every single patient encounter. We take the knowledge that we have, we call this evidence-based medicine. We take this general information, apply it to the particular patient with their particular history, their particular med list, their particular complaints, their particular physical exam, and then we make judgments. We use this. This is applied reason, subjective decision to act in a specific way based on objective data. Now, sometimes we think that certain types of medicine we don't really do this, you know. So, for example, a 16-year-old girl walks into my clinic and she's got a sore throat, a fever of 101. She doesn't have a runny nose. She doesn't really have a cough. She has pus all over her tonsils, and if you really want to throw it in, okay, a positive rapid strep test. Okay, so it looks like she has strep throat, right? There's no knee-jerk response here. I at least have to think about what's on her allergy list, and perhaps what will her insurance cover, or in my clinic, she doesn't have insurance, so what can she actually afford to pay for, before I decide to prescribe something for her. Now, some people call this judgment of what do I do for this particular patient the art of medicine, knowing what I should do in a case of an actual particular patient. Now, what I'm going to show you is that actually this is an incorrect use of the word art, at least in the philosophical sense of understanding virtue, of which art is one. So I'm going to talk about this, and this is really based on the work of Aristotle, so it predates all of our religions, for the most part. We can actually see three aspects of medicine that apply to three of what are called the intellectual virtues. One of the intellectual virtues is the virtue of science. This is basically about knowledge. So this is the anatomy, physiology, pharmacology, biochemistry, all that sort of stuff that you learn in usually the first year or two of medical school. This is part of what we call our speculative intellect. It's just knowing the stuff for the sake of knowing it before you do anything really with it. As opposed to that, there is another part of our intellect, which is really part of our practical intellect, called the virtue of art, or it's also known as techne. And I want you to remember that because we are going to talk about technicians. Art, or techne, is the good use of your practical intellect, which results in some product being made, or some object being formulated or generated. So there's a thing at the end of it. See, at the end of biochemistry class, you don't have a thing, right? Okay, but at the end of physical diagnosis, you actually know how to conduct a physical exam. So there is a thing, there's an object that you develop. That's the application of the art of medicine there. So we usually think about art as being like painting a masterpiece or sculpting a sculpture, but really performing a statistical analysis or doing a bypass or creating a treatment plan, those things would actually fall under this definition of art or techne. And again, think about these things because we're going to come back to this idea of technicians. Now, designing a plan that could be done, formulating a treatment plan, designing the plan is not the same as deciding on the plan that should be done. Designing the plan is governed by the virtue of art, whereas deciding on a plan to actually do, choosing one among several, is actually under the guidance of the virtue of prudence, or what's also called practical wisdom. Okay, so art produces a product, good product, we hope, but prudence actually guides the right choice of human actions, whether or not some material object results. I think you all know that good medicine is not just about getting a good result or a good product. We do want to do that, but it is possible that you could get a seemingly good product out of some poorly chosen human actions. So for example, if you're the recipient of a well-functioning, skillfully transplanted kidney, that's a great product. But what if you got that kidney in a way that it resulted from the death of an unwilling prisoner who was identified as a suitable donor for 2 needy patients? So the technique, the art there, perhaps was stellar, but the judgment in that case is absolutely hellish. Now, this distinction between art and prudence is crucial because prudent judgments, which in fact are judgments of conscience, are the essence of good medicine. It's not simply about expert techniques. The good doctor is not the one whose technical scores are outstanding, but the one who makes good clinical decisions using the science and the art of medicine. Now, I do want to make that clear. Prudence gets you nowhere if you don't have good science and good art. But the good doctor, the one who is true to the professional calling, is in fact the prudent doctor, the one with practical wisdom. It's not just about what can be done, but it's about what should be done. So again, why make such a point about prudence? It's because prudence, I would say, is one of those two pieces that's necessary to develop a well-functioning conscience. Again, if we think about it, conscience applies universal principles to a particular situation. There's the sort of what we know and then the how we decide to use it. The what, I'm going to actually argue, is really part of moral truth. The well-formed conscience uses moral truths known in a general way to make individual decisions which are guided by the virtue of prudence. Now, if we use an analogy here, I would say it's something like this. You might know what a healthy diet is supposed to contain, right? So you might have the knowledge. But if you don't actually choose to eat the healthy things, the healthy diet isn't going to do you any good. So in a sense, what we're talking about is not simply that you have the information, but that you actually practice that information, and that you then develop these habits within you. Right? After a while, if you actually eat in a healthy way, you actually like eating in a healthy way. And so you develop this as a matter of habit. And in that sense, we can develop prudence as a habit, which then leads us in an easy way to make good decisions based on conscience. So what do we mean by moral truth? You know, some people might allow for the fact that you can sort of know the truth about the outside world, but you can't really know moral truth. Moral truth is the knowledge of good and evil. And I would say that we can understand this in the same way using natural reason. And that is, does whatever we're talking about promote or oppose the nature of the thing? So, for example, the human being is alive and is meant to be alive. So depriving one of life is evil because it goes against the nature of the thing. If you provide food to a hungry child, this is a good because in fact nutrition is necessary to support the child's nature. Stealing what rightfully belongs to another is evil. Teaching someone to read and write is good. In all of these cases, we know what is evil and we know what is good based upon an understanding of the nature of the thing, the nature of the human person. Okay? This is not a matter simply of agreed upon convention or a democratic decision. It's not an arbitrary decision of an autocrat, and it's not even simply the revealed word of some deity who is supposed to be obeyed. We can actually come to an understanding of the Ten Commandments without those being revealed to us. We can come to them by natural reason. So we can know what is good or evil by understanding our nature. It's in our nature to be living and to function well, not only in our body, but in our mind. And so any of those things that supply, those things which promote our nature, our well-functioning nature, fall into the category of good, of moral truth, and that is what is good for us. Now, some people would say, well, hang on a second, but what does moral truth have to do with the practice of medicine? Isn't medicine actually about science? Well, I would say that actually there is an underlying moral truth to medicine. Now, many people think that the underlying moral truth to medicine is, first, do no harm. Now, that's a pretty good moral truth, but I would not say that it's the basic underlying moral truth of medicine. I would suspect none of you went into the medical field because first, you wanted to do no harm. In fact, the first thing you wanted to do was to actually do good for another person. That is, it's not about non-maleficence, it's actually about beneficence or benevolence. And I think each one of us would hope that the doctor taking care of us as a patient would be, in fact, a doctor that is operating not by non-maleficence, not first by don't hurt me, but in fact by wanting my good first. So I would say that medicine is before all else a moral endeavor. It is not first a scientific endeavor. It merely uses scientific truth to achieve the proper end, which has been there for centuries, right? Medicine was around before the scientific method ever existed. People understood themselves as doctors in this profession of healing, of attempting to restore the right functioning of the human body and mind, not because society owed this to a suffering patient, but because, in fact, one who has training in this area is called to place his skills at the service of his fellow man, to do good for the one who is ill, and even to will the good for another. So the development of science of human biology and all the associated applications that we see in medicine, especially in the last couple of centuries, this merely helps the physician to do better what, in fact, physicians were trying to do all along. So if we go back to the example that I gave earlier of the 16-year-old walking in with obvious strep throat, why do I prescribe penicillin and not levofloxacin or acyclovir or metoprolol? It's not just because of scientific evidence. It's not just about evidence-based medicine. It's because first, what I want to do is to help that young woman, to do good for her. And science has given me evidence in medicine on how to do that. Now, I do want to say that just because science can provide the facts, that doesn't mean that science itself defines what that good is. There's actually a very good article, and I'd urge you to look it up. You can get the full article online for free. It's titled "Why Science Cannot Stand Alone" by Jean Bethke Elshtain. She makes the point that when science is the driving force, knowledge for the sake of knowledge, we begin to operate by what's called the technological imperative. It's the idea that just because we can do something, because we have the knowledge of how to do something, that then that action is ethically justified. Some of you may have seen the movie Jurassic Park. Some of you, yes? Okay. My AP biology class made me watch it 1 year after we had finished the exam. They said, "Oh, sister, great movie, lots of biology in it. This is good for us." So we did. And actually, one of the characters in Jurassic Park states this technological imperative most succinctly. I think the quote is, he says, "Just because we could have done it doesn't mean that we should have done it." If we just do what science can do without considering good and evil, without considering the moral implications, without considering what's consonant with the nature of the thing, separating science from nature, we actually end up with regimes like the National Socialist regime in Germany in the mid-20th century. And Dr. Elshtain actually explains this very elegantly in her paper. This is why none of us, whether patient or doctor, want a technician taking care of us, but rather we want a medical professional who values the notion of conscience. Now, what should be obvious here is these issues of conscience, in fact, seem to run us right into what we consider the progress of science. Those issues, in fact, where the issue of conscience is very, very difficult. Now, some would like to say that, in fact, conscience is opposing science when we run into these issues, and I would say that this is not true. And I'm going to use an example of abortion and consider this from the point of view of science and then conscience. So what does science tell us about the issues related to abortion? Well, in fact, there is no question from the point of view of science that from the time of the fusion of the two gametes until birth, there is gestating a new human life. These are not simply human cells. They are not human tissues. There is a human organism, and we can also call that a human being. Now, medical science of the 20th century did not make this less clear, but made this more clear. That in explicating the identity of the genome, that we know, in fact, this is a human organism, and in fact, a unique human organism. This organism, while beginning its life situated in his or her mother, is not the same organism as the mother. So if medicine is at the service of human life, not simply at the service of science, but at the service of human life, then abortion is unconscionable. The scientific truth is that there is a human organism, a human being. And as we've already seen, the moral truth is that to destroy innocent life is evil because it goes against the nature of the thing, which is to be alive. It's not evil because my church tells me that it's evil. It's not evil because a secular law tells me that it's evil. It is evil because it goes against the nature of the thing. Now, the truth is that abortion is not justified today really using scientific evidence. And I suspect that you've all run into this actually more and more clearly. There are more and more people who favor the option of abortion, who are saying very clearly, yes, of course this is a human life. We know this is a human life. Okay, this really shouldn't surprise us, but they are saying things about this human life, making other judgments on top of it that allow for abortion. So it's not that science supports the idea of abortion. It absolutely does not. There are other things that come up. One is to say that while this human being is there, that this human being is not a human person. Right? They say a human life is not the same thing as a human person. And they would claim perhaps that we're not called upon to respect and nurture human life, but only a human person. And it's not just about physical existence that makes us a human person. Well, you see, still, this is not an argument in the field of science. This is actually a philosophical argument. Right? There's no empirical evidence that we can look to. There are no randomized controlled studies that we can do to determine who is a human person, who's not a human person. But we know what a human being is. Another way that abortion is justified, and we've heard this a lot lately, is actually on the grounds of autonomy. It's the autonomy of the parents. So this human life is perhaps not a life worth living, or they'd be better off not coming into the world. It's unplanned, unwanted, inconvenient, economically too difficult. It's not the life we had planned, or it has some physical or intellectual defect. And so doesn't deserve the autonomy that the parents already have. And I have seen this spelled out. Just recently, I actually read this in a church bulletin. The pastor was quoting somebody who gave this entire argument. Yes, that's a human life lived as a woman. Yes, that is a human life living within me. I know that. But I have autonomy that that human life doesn't have. And my autonomy is more important. And so whether I decide to bring that life to birth or not is my decision. Again, this is not scientific evidence showing that somehow abortion is right. Okay? This is some other kind of value judgment or philosophical thing. My point is that conscience, again, does not decide what is true and what is not. Conscience doesn't decide what is scientifically true or not. I would argue that in the field of medicine, in the profession of medicine, conscience uses scientific truth, along with the basic tenet that medicine is a healing profession, and then we judge what to do or not to do according to that truth. So when medical professionals conscientiously object to performing or recommending or even referring for abortion, they do so not because they feel it is wrong, not because of some strongly held belief, not because their church tells them that it is wrong, I would say that it's because they actually take their profession of medicine, their profession to medicine, very seriously. If you like, I would say they perhaps believe in scientific truth, and that basing their actions in medicine is what is the essence of medicine. Now, obviously, this line of reasoning is not held by all, and perhaps it's not even held by many. So why do many out there think that physicians really should be obliged to throw aside their conscience and accept abortion as a legitimate option among others? I'm going to show you how one physician actually explained this. And this was a letter to the editor that he published. It was published in JAMA in the 1980s. It was. And he explained it in this way. He was responding actually to another article on medical ethics. And this physician said, you know, we have to be clear on what really medical ethics are and what are societal ethics. And he wrote this. In these areas related to matters of health, birth, and death, physicians have special technical expertise to offer, and they are also the ones who perform the actions expressive of society's values. But these are not specifically medical ethics. They are societal ethics that are carried out by medical personnel. Physicians in these matters can provide advice and consent, but they do not autonomously establish any code of behavior for themselves. Examples here are the issues of abortion, birth control, and euthanasia. He went on to explain that medical ethics are things like how we behave. Are we truthful to patients? Do we get them to sign informed consent forms? But these issues, he says, abortion, birth control, and euthanasia, is not medical ethics. This is simply societal ethics to be carried out by those who have the technical training to do so. Physicians are equated with technicians. The idea of conscience and of prudence are entirely thrown out. Now, I really couldn't help wonder if this physician couldn't see the parallel between what he was describing and the physicians of the Nazi regime. National Socialism couldn't do what it did without the medical world. And the physicians were among the first to sign up as members of the National Socialist Party. So it concerns me today that many physicians, even many physicians, think that we simply work at the whim of what society determines or what our patients want. We hear this all the time, right? We are providers to those who are our clients. Medicine is simply a business, we're told, and the customer or the third-party payer or the CEO is always right, or perhaps the government. The result is that physicians are turned into technicians, and this also obviously applies to other medical professionals as well. We are no longer caring for patients, that is, those who are suffering, but in fact the latest newspeak is that we care for units. Now, what I'd like to do is actually talk about perhaps an idea or two, a specific example. But I'm really going to focus on perhaps this last one down at the end here. I think there are lots of examples, and you could come up with them, where we see this idea that we are being moved towards simply carrying out a technical function. In fact, something came to me when Frida was talking. This is a point that I've made in various talks. The pediatric medical literature shows that the population that has the most influence on kids' sexual behavior is their parents. Okay? That's the pediatric, secular pediatric medical literature. The parents have the most influence. That influence happens before the age of 15. Okay, there is no such medical evidence to show that teachers have that influence, nor that physicians have that influence. Yet my understanding is that the standard of care out there is that pediatricians and family practice physicians are required as part of their adolescent counseling to ask the parent to leave the room so that the physician can counsel the child on their sexual behavior. There is no medical evidence to support that. The medical evidence would support that the physician should ask the child to leave the room so that the physician can counsel the parent on what to do with the child. That's where the medical evidence actually is. But we are supposed to simply carry out these things in rote form, check them all off the little checkbox in terms of what we do with counseling. Now, interestingly enough, some of this is starting to get to some of the organizations out there. And I'm going to just jump down to this last one, legislative interference. This is an article that appeared in the New England Journal of Medicine in October of 2012. It was called Legislative Interference with the Patient-Physician Relationship. It was written by, or authored by, the leaders of the ACP, the Internal Medicine Group, the ACOG, the AAFP, AAP, and ACS. Right, so internal medicine, OBGYN, family practice, pediatrics, and the surgeons all got together to say, we don't like the way legislation is interfering with the patient-physician relationship. And they went through and gave some specific examples of this, where in fact they talked about things that we're being told to practice things in certain ways, regardless of our best clinical judgment. And they gave numerous examples. Right? The government is telling us we have to do these things in the exam room, but these are not medically appropriate. They don't fit our patients. The government has no business doing this. They went through the entire 2+ pages of this article, never using the word conscience. But what are they actually talking about? They are talking about conscience. So is there any room in the medical profession for scientifically thinking physicians who object to these so-called sometimes medical recommendations or standards of care or procedures or mandates? Actually, that's one of the things in that article. They were very offended by mandates coming down from the government telling us how we should behave as physicians. And often these have no basis in real science. You know, does this matter? I would say that if science is left to its own, without the piece that prudence and conscience plays, we have the technological imperative. Just because we can do it implies that we should do it. Again, conscience is the judgment of the individual person in a particular case using some universal principles. Medicine, I would say, is a moral enterprise engaged primarily in promoting the physical and psychological good of another person. It uses scientific truth to accomplish this. You know, we hear more and more that there's no place for conscience in medical practice. We're told that those whose consciences prevent them from practicing medicine as society has determined it should be practiced, that we should perhaps bow out of medicine, or we shouldn't apply to certain residency programs, or shouldn't even consider medicine as our field. And perhaps in the future, men and women of conscience will not be able to get a medical license. I would say that if we lose the place for conscience in medical practice, we lose not only some outlier physicians who chose the wrong career. We will be left not with medical professionals, but in fact, medical technicians. And I would say we would lose the profession of medicine. I would just like to finish up with a few of the last words of Franz that were ever recorded. He wrote this in a letter. Just as the man who thinks only of this world does everything possible to make life here easier and better, so must we too, who believe in the eternal kingdom, risk everything in order to receive a great reward there. Just as those who believe in National Socialism tell themselves that their struggle is for survival, so must we too convince ourselves that our struggle is for the eternal kingdom. But with this difference, we need no rifles or pistols for our battle, but instead spiritual weapons, and the foremost among these is prayer. Through prayer, we constantly implore new grace from God, since without God's help and grace, it would be impossible for us to preserve the faith and be true to His commandments. Let us love our enemies, bless those who curse us, pray for those who persecute us. For love will conquer and will endure for all eternity. And happy are they who live and die in God's love. Thank you very much. Yes?
So that was wonderful. I really enjoyed it. You know, this whole concept of evil and good, I mean, as soon as you use the word evil, you are characterized as using a subjective notion and imposing it on everyone around you. I think it's really important that you boil good and evil down the way you did into something that's more objective. Just a comment on that. Any comments on that?
Sure. So the question or the comment was about that when, as soon as we use the word evil, we're not accepted very well. And so perhaps really boiling it down to this idea of the nature of the thing is a better way of doing it. So in my medical practice, this is actually what I do when I talk to patients. I work in a Catholic clinic. I'm a Catholic doctor, rather an obvious Catholic doctor. And most of my patients happen to be Catholic. But in talking to them about issues like these issues, I never introduce the idea of, well, this is what the Catholic Church teaches. So, for example, when I have a patient who comes to me, I did have a patient like this. He was in his early 30s, a young Hispanic male, and he came in supposedly for a physical exam. They never come in for physical exam. There's always something else that's going on. At the very end, he wanted to ask me about, that operation, he said. What's it called, that operation? Not to have any more babies. And I said, you mean vasectomy? And he said, yeah. And suddenly he looked at me, he kind of realized where he was. I looked at his chart, and it said Catholic. And he got really embarrassed. And I said, well, let me tell you what I think about that. I said, what you're asking me, I explained it a little bit more at length here, but what I said, you are asking me to recommend an operation for you which destroys a part of your body which is functioning properly because it's functioning properly. And I can't do that because as your doctor, that is not my job. Now, he said, okay, and I left the room, and I came back, and I was sure the conversation was over, but it wasn't. The first thing he said to me when I walked right through the door was, he said, you are right. I couldn't do that to myself, and I couldn't ask you to do that to my wife either. But we have 3 kids, some financial difficulties, what else can we do? So we talked a little bit about fertility cycles on the exam paper on the exam table. So I think we can always explain this. I have patients who are Muslim. I have one who came to me with an IUD. She wanted to get an IUD. Her 8-year-old son was translating for her. This was a total disaster. But the message that I got was through the mom was, this is actually against my religion, but I'm asking you that I want this. And I said, you know what? I can't do something for you that you're telling me is against your religion. And I very often explain to them, especially the abortifacient aspect of the IUD. My patients always come to me having had their IUDs placed at the health department, always saying, nobody ever told me that. And they're just incensed. So yes, we can explain these things in scientific ways, according to the fact that we are there to care for these people as human persons.
Okay.
Okay. Sorry. By the way, thanks for that wonderful lecture. I like particularly the way you get right to the simple core of things. And the three questions came to mind about some of the things you talked about very early on. One was about science and about something antedating science. It always seems to me that science is also a function of natural reason, and that it's not really some particular process that was invented at a point in time. The second thing was, in the very beginning, you talked about the concept of wrapping my mind around something, and I never have any trouble wrapping my mind around anything, but I do find things often impenetrable. So I believe that this whole concept of wrapping a mind around something is the way women think. It is a female way of perceiving reality. Men penetrate things, and women surround things. I just wonder if you might comment on that. And the third thing is, among all the list of common fallacies that are stated all the time, one of them that's not stated all the time, but it's there if you read it, and I think it's what actually motivates science and its evil applications to medicine as we see it today, is the idea that there's no such thing as life, that it's just molecules working in a certain way, and that there really is no vital principle or anything such as life. So I just wonder if you would comment on those.
Just see if I can say a word about each one of those in backwards order. To those who say there is no life, I think it is so obvious to us when we see a corpse that there is no life, and when we see a living human person. I mean, to me that's somewhat self-evident. The idea that men and women think differently, I think, is very true. That would be a whole other lecture on Christian anthropology, which I just did last week down in Nashville. So that's a great thing to talk about as well. And that, yes, science is not really just about the scientific method. Science existed, right, for Aristotle long before the scientific method did. The problem is that our current bias is that it's not science unless we do the scientific method. But that is very true. Science does predate the scientific method. And it's our reasoning knowledge, yes.